for mismatch repair defect patients, we are trying to move use of pembrolizumab, atezolizumab, or nivolumab into first-line settings. So there are a bunch of first-line trials that are open. One of the major trials that's open right now is a frontline comparison of metastatic colorectal cancer patients who are getting either chemotherapy or chemo plus immunotherapy. So that's one of the trials that I would move patients towards. If you have a BRAF mutation, the current standard of care comes from the Beacon study, which has already been completed, which showed that both the triplet agent, which is anti-EGFR, anti-BRAF, and anti-MEK, was very effective, but it was almost as effective as anti-EGFR and BRAF. And therefore, the doublet is what I think is a good standard. So there are some trials that are trying to build up on that. One of the trials that is at MD Anderson is anti-BRAF, anti-EGFR, and nivolumab, which is immunotherapy. And then there are other trials in which they are trying to inhibit another player in this pathway, which is called ERK. To try to see if we can increase the efficacy of these drugs. For HER2 studies, there are lots of immunotherapy HER2 studies that are coming up. There are antibody drug conjugates that are coming up, and one of the largest studies, which is the randomized SWOG 1613, is currently running, which compares trastuzumab pertuzumab, which is anti-HER2 therapy, versus cetuximab irinotecan, which would be considered standard of care for these patients right now. That's a national trial which is running across the US. So those would be some pivotal trials that I would direct patients towards.